The mainstay of treatment is number one, to control their pain. Number two, to search for any complications related to the rib fracture, such as bruising of the lung or a collapsed lung or something along those lines. And then number three is really just supportive care after that point. Occasionally patients have to be admitted to the hospital depending on their underlying health disease, their age, their ability to comply with activities of daily living, how easy it is to control their pain, those sorts of things. And then one of the things that's true about rib fractures, particularly in the setting of trauma, there can be other injuries besides just the rib fractures, and sometimes those are actually why we end up admitting a patient to the hospital.
Is there anything you can do? I mean, like when someone breaks their arm, generally you can put it in a cast or at least put it in a splint, but you can't just wrap somebody up necessarily.
Right. There's a little bit of controversy about that. There are things called rib belts, and you can put those on to help splint some of the chest movement. The disadvantage of a rib belt is that it constricts breathing, and so people are less inclined to take big deep breaths when they have the rib belt on. And really one of the things that they need to do with the rib fracture is to take 10 big deep breaths per hour so they keep their lungs open to prevent pneumonia. It seems that we see more incidents of pneumonia and pulmonary or lung complications with people wearing rib belts.
How long would you wear a rib belt?
6 weeks.
Wow.
So that's why I think most of us, particularly around here, just focus on pain control and deep breathing exercises and that sort of thing.